Margie here. Are you ready to learn about 5 common mistakes that people make when it comes to their bone health? Well, if so, you are in the right place because that's what we're focusing on today. And our special guest is Dr. Doni Wilson. And Dr. Doni is a naturopathic doctor, clinical nutritionist, best-selling author, and internationally renowned speaker and thought leader in women's health. For over 25 years, she has been on the cutting edge of healthcare, helping women to transform their bones and overall health. And today she's sharing what she has found in all these years as the most common mistakes that are made and what we can do about it. So this is filled with great information. Stay tuned. Welcome, Dr. Doni. So happy to have you here on the podcast.
Thank you, Margie. I'm so glad to be here.
We've known each other for a long time. And what I love is you've spent over 25 years as a naturopathic physician working with people with osteoporosis and bone loss. And so you just have so much to share. And unfortunately, there's mistakes that people make. So I'm excited that we're going to alert people to it because when they figure these things out, there's so much that can be done, as both of us know. So welcome.
Thank you so much. I'm so excited about this too. And yes, this is a thing. When I'm helping thousands of women for 25 years, I start to see the patterns, right? Of like, okay, when a woman first contacts me and says, I got a bone density result back and it showed osteopenia, let's say, or osteoporosis, and they say, what can I do now? And so that's when I start asking questions and figuring out where are they starting from. And that's where I start to know, like, okay, I'm going to look for these 5 things first because I know that can make a huge impact in their bone health and their future.
Yeah, and you know what I like? There's so few people like you, unfortunately, Dr. Donnie. I mean, it's getting better, but who take this integrative approach, look at the whole person, look at all the body systems together. And then when you do that, that's the good news that so much can be done. Not only do we improve their bone health, but everything improves along the way. So this is just so great. Okay, so we're just going to get started with the 5 common mistakes that you see people make. So you want to start with the first one?
The first one has to do with calcium. And there's so much confusion about calcium out there. So I understand why some people come in and they might be taking a product that contains calcium, but maybe it doesn't have enough calcium. Or other people heard that calcium was not a good thing, and so they're not taking any calcium. Or maybe they're even trying to get too much calcium. And so it can be anywhere on that spectrum. And so I would love to just start to set the record straight of what is the deal with calcium? Should you have it? Should you not have it? And so I'm usually looking for, that's where we're usually beginning. And I would say, and I look forward to your input too, of course, Margie, but the thing is with calcium, we do need some calcium when we're having bone loss, and we want to help to either avoid medications, or at the very least we want to help restore some bone, right? This is what I see with my patients, by the way, is when I fix these 5 mistakes, their bone density improves. So it's like, okay, that's what our goal is, right? We want to improve bone density and prevent bone loss. And so we need some calcium, but the key is we need to be getting calcium that's absorbable. If you're going to be swallowing calcium, we want it to be highly absorbable. And a lot of calcium is not highly absorbable. Like calcium carbonate is the lowest absorption. So now you're buying the supplement, you're swallowing it, but most of it's not even getting into your body, let alone to your bones. So we want to be choosing calcium like calcium malate, calcium citrate. There's a couple other forms of calcium that are high absorption calcium. And in that case, you don't even need as high of a dose. The standard in dietetics, you'll always hear, oh, we need to be getting postmenopausally 1,500 milligrams of calcium a day between supplements and diet. And really, first of all, that's really hard to do. You'd have to swallow a lot of calcium to get to 1,200 to 1,500 milligrams. And second of all, it's not necessary. It's too much calcium, I think. And so I'm usually aiming for between 400 and 600 milligrams of calcium in a highly absorbable form of calcium, along with some dietary sources of calcium, in order to get a good amount of calcium. And the key is, again, not too much and not too little.
Yeah, I see the same thing. I see where more is not better. People think, "Oh, so they're already getting some in their food, and then they're put on maybe 1,000 milligrams. And so they're getting way too much. And research shows a 15% increase in cardiovascular issues when calcium is, over 1,000 milligrams. I mean, it's not a good thing. So it's the combination, just like you say. And that calcium carbonate is the cheapest. And it's, easy to take. Oh, I'll just take it in a chew, or I'll just take it in this. So that's so common. So I think that's such a good point.
So pull out your supplement if you have one that has calcium and see, don't just look for calcium on the label, but turn it around and be like, what is the word that comes after calcium? And that's the key. Calcium can be attached to a lot of different things, but the one that says carbonate is not going to be absorbed very well. And there's no need to, because a lot of times then what happens is people think, well, I can't take over 1,000, and so they just give up and don't take any. And so we're saying, don't give up and take none. And sometimes people worry about the heart disease, and so then they don't take any. So we're saying it's not about taking none; it's about taking the right kind, and it doesn't need to be over 1,000 milligrams. Especially when we get to number two, mistake number two, which is that most people are either not taking vitamin D or they're not taking the right amount of vitamin D. And this is so important because vitamin D helps with the absorption of calcium from the gut. So you're swallowing this calcium, but if you don't have vitamin D, it's not going to get absorbed into your body. So we need to have the vitamin D there. But the key is that really, to me, I would rather do a blood test for vitamin D levels. Now, there's some different things that can affect your vitamin D blood tests, and that's a whole nother complex issue. But in general, I feel like as a practitioner, I'm going to always measure a patient's 25 OH vitamin D level in their blood because that can give me a sense of where they're starting from with vitamin D. And many people don't are way low, like less than 50 on their vitamin D in their blood levels. Do you find that too?
Yes, yes. What I don't like, again, is it's not one size fits all. And that's why I love the work that you do because it's so individual. And I think, a lot of times people will just buy a supplement package or something. And you can't differentiate. Like each person, some people are out in the sun, some people. So I think that they need to figure out their own vitamin D level. And it will be different depending on, if you have autoimmune conditions. The optimal vitamin D is something you really need to work with your practitioner, and I believe, and figure out. But, some people say, okay, everybody should take, 1,000 IUs, or everybody should take 2,000. That may not be nearly enough for some people. And for others who are out in the sun all day, so I think that I see that all the time. It's just, or sometimes these bone supplements that everything's together, it's not the right dose because it's not individualized. So I couldn't
Abs-
agree more. It's so important. And you're right, because a lot of times they'll say 30. I know different societies say that this is the minimal that you need, but that's very low in terms of
The
vitamin
levels in the
D.
blood.
Yeah.
Yeah. Yeah, like I'm usually aiming for 50 to 80 on the blood test. And again, it's such a good point. I encourage patients to get to know what is the amount of, because there's also genetics involved. Like you said, sun exposure, but there's also genetics of how well your body takes in the vitamin D. So we need to get to know your body. How much vitamin D do you need on a regular basis to help maintain an optimal level? And it takes a little time to get there, right? You're going to need to first get your vitamin D over 50, between 50 and 80, and then you're going to need to know what is my maintenance dose to keep it that way. And then the other aspect with vitamin D, which I'm hoping everyone's starting to see this and hear this, but really now I always combine vitamin D with vitamin K. So I encourage you, again, look at your supplement, and if it only has vitamin D without any vitamin K, we need to get you on a different supplement, because the vitamin K, the way I think about it from reviewing the research, is okay, you swallow the calcium, the vitamin D helps get your calcium out of your intestines into your body, but then the vitamin K helps deliver the calcium to your bones. And this is where some people worry, where what if this calcium is landing somewhere else in my joints or in my, in my blood vessels? But the way you can make sure that that calcium makes it to your bones is by having vitamin K. And vitamin K is a tiny substance, so is vitamin D. So it's very convenient to put them in the same capsule or supplement together, right? So it's very easy to say, let's just put the vitamin D and K together. And this way you don't have to necessarily take two different supplements. You just take the D and K together.
Hey, Margie here. As a physical therapist, I know firsthand how important exercise is for our bones, overall health, and happiness. And unfortunately, there's a lot of confusion on what exercises are safe and effective for people with osteoporosis. That's why I created this handout that contains a 30-minute video where I explain the concepts so you understand the do's and don'ts when it comes to exercise. And this is important because this way you can go into any class and know what you should be doing and what you should avoid. Because too many people are doing exercises that actually increase their risk of spinal fractures. I also included videos of me demonstrating effective balance, posture, and weight-bearing exercises you can put into your day right away. So all you need to do to access this handout, it's free, is go to tinyurl.com/osteoporosis exercises. So it's tinyurl.com, again, /osteoporosis exercises, or you can click the link in the show notes. Now back to the show. Yeah, unless their D is, sometimes that's not, or they
It's true, but a lot of times you can get it you can make it more efficient that way. You're right. If someone's D is really low, you might have to have a separate D to get their level optimized first. But eventually, so what I would say is if you're taking a D, let's say a D 2000 or D 5000, make sure it's a D with K, because or else if it's not, then you're going to have to add a separate K, either MK4 or MK7, to make sure that you're really getting the calcium to the right place.
Yeah, I think that's one supplement that's so frustrating to me because I think K2 is critical and there's good research on it and I don't know why. Most doctors will just prescribe, we'll just tell people calcium, vitamin D. And even though there's such good research on K2 and that's so important for the calcium to get into the bones and out of the soft tissue, that it's not appreciated. So, okay, so we
Very
have
true.
calcium,
So
the right D level that we have to measure. We don't just test. We don't just guess. We test that, make sure we test. And vitamin K2. Okay, let's go to
bone
the next
markers.
mistake. Yes, that people.
Yes. This is the thing, is that a lot of times people are really guessing. It kind of becomes almost like guesswork when it comes to and a DEXA scan, usually it's going to be covered by insurance every 2 years. So now you're in this 2-year window and you're like, well, I hope what I'm taking is working. I got to wait till I have this next DEXA to get a sense of it. And so it's a big gap in time. And I think that's where, when we're trying to optimize, prevent bone loss and even increase your bone density, that's too long to wait. And we don't have to wait that long, because there's testing we can do. There's both blood and urine markers that we can measure that help us understand, is what you're taking and doing in your life to help with your bones, how well is it working? Now, most times your doctor is not going to know to order these tests. So you're going to need to ask for these bone markers. And so what I do is, I've looked at many different bone markers over the years and different tests. And what I find is the simplest to start with is to ask for what we call a CTX, which is the C-telopeptides. And they can run this. Most labs can run this on a regular blood draw. So I always recommend, especially if you're postmenopausal and you're working on your bones, have that tested, have that added to your blood work, the CTX. And then what you can do is, because I like to see the CTX less than 500. And so if I see, okay, let's see, it comes back at 550. And then we decide, okay, let me get an optimal calcium dose. Let's get an optimal vitamin D and K2 dose. And then 3 months later, we can test the CTX again and see if it's coming down. And so you get a much faster way to get feedback about whether what you're doing is working.
I'm such a believer in the CTX, and I think it tells you because so often people will get the bone density and that have a certain number. And all of a sudden they're ordering medications and doing this, but we have no idea. Are they actively losing bone? What's going on? It's just so very important. And that's where the CTX comes in because you know. And I have found the good news is that because when we educate people, they become knowledgeable. And I think it's so important because, knowledge is power. But when you have a conversation with your physician and your practitioner and you say, I really want to see what is going on. Am I actively losing bone? Then they will order it. And again, I think the big problem though is sometimes they don't realize it has to be first thing in the morning and there are certain things, but in general, it really tells us what's going on. And as you said, the DEXA may not, you find out much quicker if what, if things are working or not. You can get another one 6 months and see if things are happening. So I think that is a mistake. And I just wish it would be out there more
I'm
because
so glad we're talking about it. And there are some other markers too. So if you end up like going, okay, I want to get even more detail. Yes, you can do the P1NP. You can do some of these other markers that I know you've talked about on the podcast before. So if someone wants to dig into that level, definitely it's fine to do. But as a practitioner, what I find is that CTX is at least can give me so much insight and it helps the patient know too because when you see that CTX coming working its way down lower based on what you're swallowing and it's telling you you're having less bone turnover based on what you're doing, it's such good feedback. So then you can you're like, okay, I'm going to keep going then, or maybe we need to adjust some doses or adjust your lifestyle until we get it to a good place. So it's very motivating for these changes you're making too.
yeah, I love the CTX combination in P1MP, but you're right. Sometimes you have to, so if people can get both, to me, you get to see what's breaking down your bone and what's building it up. But at least the CTX, you see, is something going on? Is there a process going on where you are actively breaking down bone? It's so, so important. And it's a blood test. It's so doable. And it's real. I think it's changed. It's so interesting to me just seeing different cases and seeing where someone's CTX is through the roof. So something's going on. We need to figure out what's happening. And that's why I love the approach you take and the integrative approach because all these things are totally doable. Okay, so now bone turnover markers. And what else? What other? I know there's two more that you wanted mistakes that people are making that they're just not addressing.
Well, another common mistake is not realizing that our gut health is related to our bone health, right? So we're thinking so much about the bones, but we're not realizing that what's happening in your digestion is absolutely been shown to be impacting your bones. So we need to start looking at your gut health. And that sometimes people don't even have any digestive symptoms. I'll ask them and they'll be like, "Oh, my digestion feels fine." And yet when we start looking closer, we start to go and I'll say, do you have any reflux? Do you have any bloating? Are you having a bowel movement every day? Or at least maybe at least once or twice a day. And so that's where we start to get to, oh, well, maybe I do have reflux sometimes. Maybe I do have some bloating. Oh, yeah, my bowels are not quite as regular as that. And that starts to give me hints. And even then, I still will look deeper because I'm looking for something called leaky gut when the intestinal cells are not as healthy as they could be. And if the intestinal cells are not as healthy as they could be, we're not going to be absorbing our nutrients well. If we're not absorbing our nutrients well, that's going to impact our bones right away. That I think makes direct sense. Also, we need to look at the microbiome. And the microbiome is impacted by so many things, including stress and toxins and medications. And so these bacteria in our gut are related to our bone health. And so, actually, by doing some testing to find out if there's an imbalance in the gut microbiome, and the treatments I use for optimizing the microbiome are going to be using herbs and nutrients and probiotics, not antibiotics. So we can optimize the microbiome. And by doing that, we see such an improvement in the bone health as well as your whole health. So it again, it's just if you're really seeing that you're losing bone, absolutely, we gotta look at your bone health. I
Yeah,
mean, your gut health, excuse me.
and is that one of the first places you start, the gut?
Yeah, the gut. I mean, it makes me think as I'm saying this, I'm thinking, of course, we got to also look at hormones and postmenopausal hormones as well. We can see if we want to talk about that. But I think a lot of times women will think about estrogen more often than they'll realize that their gut is related to their bones too.
Yeah, people don't, and I think what you said was so important. Not sometimes you may have gut symptoms, but other times you may not. You may not. It can manifest other places, and we don't appreciate that. And so I think doing these other testing is so important because we can't minimize the role. So I think that is something that people, don't even think to address unless they're having issues with their stomach or constipation or something like that. But, so often that's not the case. But we need to, no matter what, just make sure that the microbiome and yeah, I couldn't agree more. The last one is one that both you and I are so passionate about, and I love what's on your wall because you've written an entire book on this, and so why don't you share the last one that's the biggest mistake that's so I mean, you want big of it. It's a very, very big mistake that people aren't paying attention to and don't value. So why don't you share what that is?
It has to do with what we might call lifestyle, but also stress. And it's because like we're so focused on the bones and we're like, and then of course when you go into the doctor, they're just saying, "Oh, just take this medication or get this injection." But it's like not at all paying attention to or acknowledging that our lifestyle has so much to do with our bones. And what does that mean? To me, it means everything from our diet to our sleep to our what I call recovery activities, like what we do to help ourselves recover from stress and trauma, and exercise. And I think exercise is one that people are a little more connecting with, right? They usually, when they think of their bones, they're like, okay, I need to do some weight bearing exercise. That people are usually they're not always doing it, but they're aware of it, right? We go, okay, I need to be getting some weight bearing exercise. And so where the mistake they often though are making is, oh my gosh, my diet, so the foods I'm eating can impact my microbiome and my bones. And then also what we're doing in terms of each day helping ourselves recover from stress. How can we use journaling, breath work, meditation, all of these activities, mindfulness in general, that can help us to recover from stress as a way to help our bones.
You want to just go into this a little more, why stress is such a big issue and what it's actually doing to our bones?
Well, brings me to think about the cortisol, which is our main stress hormone. So, we all have stress, right? And so a lot of times we want to just ignore it or wish it didn't exist. But the fact is, as humans, we're gonna have stresses, whether it's in our day-to-day lives, just deadlines and maybe family or relationship stress. And it can also be stress and trauma from way back in our even from our childhood that's still impacting our health today. And so to me it's about okay acknowledging yes I'm human, I'm going to have some stress and even some trauma. And the where I tend to focus is on realizing that there's a lot we can do to help you recover from that stress. So instead of dismissing it or ignoring it, we can say, oh, what is your cortisol level based on your stress exposure? Is your cortisol too high or is your cortisol too low? Because actually both of them can impact your bones. So to me it's so often missed that people what I do with my patients is I recommend to measure your cortisol. It's not enough to just guess that you have high cortisol or assume that you have high cortisol. I would say we have to measure your cortisol. So I recommend that patients measure their cortisol in either urine or saliva at different times a day, right? So we measure cortisol morning, midday, evening, and bedtime. This is not done at a regular lab. So whereas like vitamin D and CTX you can get at your regular blood work and probably covered by insurance. But with this cortisol at 4 different times a day, this is probably an out of pocket test, but it's essential and life changing because once you see what your cortisol's up to, right? This is a screenshot of how has all the stress you've been exposed to in your life, how is it impacting your cortisol at this moment in time? And if your cortisol might be high in the morning but low in the afternoon, or it's low in the morning but high at night, either scenario, then we can take steps to help optimize it. We can not only use lifestyle, exercise and stress recovery to help lower your to bring it back to optimal, but we can also use nutrients and herbs that have been shown. So so this is the thing, Margie, is if someone has high cortisol, we're going to use different herbs and nutrients than if they have low cortisol. So that's why it's so important to know, so you're taking the right herbs and nutrients at the right time of day. And what I see is when I can guide a person to bring the cortisol should optimally be higher in the morning, not too high, but higher in the morning and gradually decreasing through the day. When we have that happening, the research shows, and I see clinically, that people's bones improve, let alone the rest of their health. But because now the cortisol is sending the right signals, right? If cortisol is constantly sending a stress signal, then you're going to be more likely to lose your bone density. But if we can get a healthy cortisol level, your body's going to be saving your bones. And so it to me this is so key to this whole conversation.
So key, and I don't know what it is, Dr. Donnie. I don't, because 'cause I'll see people all the time, and they are absolutely frantic. Are they getting the exact amount of calcium, or are they getting they may care a lot about their supplements, and they're very concerned about the exercise. Are they doing the right exercise, which is all good, but they don't realize that this stress piece is breaking down their bones, and it's so very important. Do you wanna talk? Because in your book, you go through different types. You wanna just tell what you did a little bit in your book? Because I thought that was so interesting, and it was a little different take on the whole on just how you looked at it with all the different types, and you wanna just share a little bit about that?
Yes, and I was gonna say, like, even with exercise, a lot of times we find out that the person might be over exercising, which can raise your cortisol, and you didn't even realize you were raising your cortisol while over exercising. And so it's about helping us understand our bodies and what their needs are and fine tune it. Just like you got to fine tune your vitamin D dose, you got to fine tune your calcium dose, and you got to fine tune your exercise dose, just the same, right? And so what I do in the book is I break down the way what I found in my research, which is that stress is not one size fits all, right? We all have stress, but it doesn't affect us all the same. And this is why testing is so important. Testing versus guessing. And so the stress types have to do with whether your cortisol is too high or too low, and whether your adrenaline is too high or too low, because adrenaline is also a stress hormone and we can measure it in urine. So when you get those two pieces of information, when you know what is your cortisol up to at various times a day and what is your adrenaline up to, that determines your stress type. And based on your stress type, then we can create a whole protocol around that for you, right? How much exercise is the right amount to optimize your cortisol and adrenaline, which is different than someone else who has different levels. What is the right amount of meditation for you? What are the dietary factors for you to take into account? Even how much meditation is the right amount of meditation for you based on where your cortisol and adrenaline levels are. And so that's the concept in the book, and I guide you through then what should be your what I call your care, right? In terms of self-care is an acronym. C for clean eating, A for adequate sleep, R for recovery activities, E for exercise, right? How do we take care of ourselves based on our body's response to stress so that we can really individualize our stress recovery? And this is huge when it comes to bone health, way more than we might realize, right? We don't realize that our bones are paying attention to our stress, but they are.
Yes, I mean, I teach a happiness program, and I just think I've seen this my whole entire career as a physical therapist, that this piece changes muscle, it changes everything, and it's just not appreciated for how critical it is. And what do you see, though, when people do these steps, Dr. Donnie? What do you see in terms of what happens to their life? Like, what have you seen?
Well, I'm thinking of like because I've been in practice for over 25 years. I see women who came to see me over 20 years ago worried about their bones, right? They're like, I've got osteoporosis and I'm reacting to the medication, or I prefer not to take a medication. I want a long-term solution. And so I guide them to correct these five mistakes we just covered, including optimizing their cortisol and adrenaline. And what we see is not only do they stop losing bone, but they actually have their bone density improve, and they completely get out of the zone of osteoporosis and osteopenia. And then they are able to go on having healthier lives for longer, right? That's the whole goal. How can we have be healthier for longer? So we're in that same process, we're ending up preventing diabetes and heart disease and dementia and cancer, because some of these same aspects end up helping in those ways too. And so it's very exciting to get to, at this point in my career, be able to look back and be like, wow, this patient has been my patient for over 20 years, 22 years, and their bones are amazing. That is not even at all the worry on the table, because we corrected these mistakes years ago. And it's just so rewarding to see that happen. And so I'm so glad to get to come and share so that more women can have this information and to know that there's so much you can do to help your bones. I'm so glad you do this, Marjorie, to help them too, because it's not something that is shared in the standard medical system. You're not going to hear about this there. You're going to have to sort of take it into your own hands and be like, what can I do to help my bones? And a lot of times women are very afraid, right? So that fear is motivating. Like, I don't, afraid of osteoporosis, afraid of bone density. So let's, if you're feeling afraid, this is the time to go, okay, let's put this into action and correct these mistakes so you can get the most out of this and help your bones as well as your whole health at the same time.
I love that. What do you tell people? That's an interesting point about fear, because fear can stop you in your tracks. And what do you have any good tips on fear?
The thing I find is, first of all, just noticing it. Like a lot of times the fear takes over, and we identify it so much that we can't even make a perspective or a decision about it. We're just living in fear. And so one thing is to just be able to stand back a little bit and take a couple breaths and like notice it. Even like, as if you could hold it in your hand or write it on the piece of paper. What is my fear? Because now you're separating yourself from the fear. You realize, I'm not the fear. Yes, I feel afraid because the doctor said something that scared me, and I'm afraid what that means for my future. So it's not about dismissing the fear. It's about separating yourself from the fear and say, okay, here's what that means, and I can breathe and I can acknowledge it. And then I, as the person who's in charge of this body, I can make a different decision. I can say, okay, well, if I'm concerned about bone loss, what actions can I take to prevent that? And so now you're going into action instead of being stuck in fear.
Yeah, I think being in action is so, so important. It's sort of like, staying in fear and feeling badly for yourself and poor me, and then getting into the action mode and acknowledging it. I think that's important to acknowledge it, because sometimes we don't realize what's holding us back. So I think that's so important. Is there any other, I mean, you have so, I know you've written an entire book on stress, and to me, this is so important. Is there any other little tips that you want to share before we
Mm.
end? Because you have so many good nuggets that you
Ah,
teach, that I think, to me, this we say that people don't appreciate, but this is just so valuable. Is there anything else that you want to share with everybody before we end, in terms of things they can do in their life?
well, thank you. And I would say it's around this, what we talked about in terms of, first of all, knowing that it's possible, that there are women who have followed these steps, corrected these issues that we talked about today, and they've benefited from it. So once you can see that other people have done it and it worked, and that it's possible to help your bones, that your bone density can improve. So you start to go, okay, this is already crossing off some things that someone else told me, and we can say, that's not true. Let's delete that comment, and let's start to create a vision for your body's ability to heal. And so that's a lot of what I do, is like really creating that mindset space to say, what is your healing intention? Write it down. Write it down, say it out loud every day. My healing intention is I have healthy bones. I have strong bones. I have, right? You put it in a positive and you say it in the present tense as if it exists now, even if that's not true yet in your body, right? You might have a report that says osteopenia, but in you want to say to your body, I have healthy bones. And you say it, you write it down and you read it to yourself out loud every day. And then you start taking these action steps toward that. And that's how we start to exponentially increase your ability to heal. So you can combine this work of mindfulness and awareness and mindset and superpower the supplements that you're swallowing. It's not just about swallowing supplements, right? It's about how do I take control and take charge of what's happening in my body, and now I'm determining my future versus what somebody else said.
Yeah, I love that, and I love that's how you work with your patients. So why don't you share? Because the nice thing is that you see people. Because I get asked all the time, "Well, who can I
Yeah.
work with?" So tell me who could s how do you work with people? Because you really can work with people virtually all over, is that correct?
It is, it is. I'm located in New York on Long Island in Manhattan. So if someone's local, like Connecticut, New York, you can come in person. I also see some patients in the Phoenix area. I'm also licensed in Arizona, California, Washington State. But when it comes to bone health, I can help you from anywhere. So I have also, most of my patients are virtual from around the US and around the world because by the point that you had, let's say, a DEXA or bone density that showed bone loss, or you're postmenopausal and so you're at risk of bone loss, we already have that information. And so you can come to me and I can say, okay, let's look at the numbers and I can tell you which test to do and I can show you which supplements are the right supplements that are going to help you. And I can help you figure out what is going to be your protocol for healing and helping your health. And I can do that from anywhere. So we can be on Zoom or phone and get you the help you need.
And do you think as a naturopathic physician, you have a different perspective? Like, how does that change your perspective in terms of.
Abs-
Yeah.
Absolutely. I mean, my original training was as a nutritionist. I first studied to be a nutritionist, and I thought I was going to be going into becoming a medical doctor or in the conventional medical field. And I started studying nutrition, and I thought there should be a type of medicine that includes nutrition. And whereas standard medicine, they get very little nutrition training, if any. And so I had this thought, and this is, me at 20, 21 years old, Margie. I was like, here I am at 20, 20 years old, and I'm like thinking, there should be a kind of medicine that includes nutrition. And a friend of mine answered the question and said, well, there's naturopathic medicine. I had not heard of it. So I got in my car and drove straight to Bastyr University in Seattle. And I said, I want to study medicine that includes nutrition. And they said, well, you're in the right place. And so this is really the distinction is I went to a medical school, a naturopathic medical school. So I learned all how to be a primary care provider, anatomy, physiology, diagnostics, labs, pharmaceuticals, all of that. And yet, after I graduated as a both a naturopathic physician and a midwife, I said to myself, now what do I want to do with this education? I have the education that I could go to a standard medical clinic and offer that. And I driving back and forth to my office day after day, I decided, no, I want to offer women what they're not receiving in the standard of care. And so that's what I decided to do. As I said, I have all of this training and I in both the natural approach, the functional approach, and the standard approach. And I'm choosing to make it possible for women to get information they're not getting anywhere else. So that's why I do what I do. And it is a difference in philosophy, it's a difference in approach. Altogether, it's looking at the whole body, right? I'm looking at you as mind, body, my spirit. It's all interconnected, right? It's not about your bones are separate from your gut or your bones are separate from everything else. No, it's all interconnected. And when we really acknowledge that about ourselves, so much healing is possible.
Ah, I love that, Dr. Doni. Well, I can't thank you enough. Is there any last minute things? I mean, I think you've enlightened us to so much. And I think it's important for everyone to think about the 5 things that we talked about today, make sure they're not making those mistakes, and so just to look at those areas and see, are there any areas that maybe you're missing and maybe not you're giving you're not giving the attention where it needs to be, so
I love it. Thank you so much for this conversation. It's so much fun always to get to talk with
yeah.
you. And I'm so glad to be able to get this information out there. I really believe it's when we have information, we can make decisions. If we don't have information, then we're stuck. So I love being able to help get the information out there, and if anyone would like to ask me questions or contact me, I'm sure you'll give my contact information, or you can find me.
You can say it out loud. We can tell
Okay.
everybody. Yeah.
My website is drdoni.com. Doni is Doni, so you can go to just drdoni or doctordoni.com, and you can find me there.
And your book's great. I mean, we had a whole podcast on your book, but I love your book. It's written that you wanna just say the name of your book?
Master the
Yeah.
book is Master Your Stress, Reset Your Health, because it's, as we talked about, when you can, it's not about managing stress, by the way. A lot of times we hear manage our stress. And to me, managing is getting us nowhere. But when you can master the stress, like we're talking about, where you actually understand and you can do something about it, now you've mastered your stress, and then you can really reset your health, including your bone health. So thank you so much for sharing that. And you can find me on social media and YouTube and all of those places also as Dr. Doni Wilson. I'd love to hear from you and hear more about what would help you to heal.
And I always see Donnie at conferences, so we always have a good time.
Yes,
So hopefully I'll see you soon, Dr.
I definitely
Donnie,
look forward to
and,
seeing you soon. Thank you
yeah,
so much for having me here today.
always a pleasure. Thanks so much for joining me.
You're welcome.
I hope you enjoyed my interview with Dr. Donnie. And let's just do a little recap to make sure that you have all the 5 areas that Dr. Donnie talked about that she sees the most mistakes. Number 1, calcium. People are either taking too much, not enough, or they're not taking the right type. So check that out. Number 2, vitamin D. Make sure that you get that tested, 25 hydroxy vitamin D, and make sure that you're getting K2 so that you can make sure that the calcium is going into the bones and not into the soft tissue. Number 3 is the bone turnover markers. Too often people are not getting these, especially the CTX, and seeing their bone breakdown, seeing what's going on. It's so incredibly useful. Number 4 is not addressing the gut, which has such a huge effect on our bones, even if we're not experiencing any gut symptoms, to make sure that we get that evaluated. And number 5, which is something that I see way, way too often, has to do with our stress and cortisol and lifestyle, and that we optimize that. And I just believe when you do that, everything changes. And to me, that's the root of all health. And just too often people don't seem to pay attention. So I think she gave lots of great tips. All the links to Dr. Donnie's work and her book will be in the show notes. So thank you so much for tuning in, and I look forward to seeing you on the next episode.